Psoriasis is a common skin condition that speeds up the life cycle of skin cells. It causes cells to build up rapidly on the surface of the skin. The extra skin cells form scales and red patches that are itchy and sometimes painful. Signs and symptoms. Psoriasis signs and symptoms are different for everyone. Common signs and symptoms include red patches of skin covered with thick, silvery scales, small scaling spots, commonly seen in children, dry, cracked skin that may bleed, itching, burning, or soreness, thickened, pitted or ridged nails, swollen and stiff joints. Psoriasis patches can range from a few spots of dandruff-like scaling to major eruptions that cover large areas. Most types of psoriasis go through cycles, flaring for a few weeks or months, then subsiding for a time or even going into complete remission. There are several types of psoriasis. These include plaque psoriasis. The most common form, plaque psoriasis, causes dry, raised, red skin lesions, plaques, covered with silvery scales. The plaques might be itchy or painful, and there may be few or many. They can occur anywhere on your body, including your genitals and the soft tissue inside your mouth. Nail psoriasis. Psoriasis can affect fingernails and toenails, causing pitting, abnormal nail growth and discoloration. Psoriatic nails might loosen and separate from the nail bed, onycholysis. Severe cases may cause the nail to crumble. Guttate psoriasis. This type primarily affects young adults and children. It's usually triggered by a bacterial infection such as strep throat. It's marked by small, water drop-shaped, scaling lesions on your trunk, arms, legs and scalp. The lesions are covered by a fine scale and aren't as thick as typical plaques are. You may have a single outbreak that goes away on its own, or you may have repeated episodes. Inverse psoriasis. This mainly affects the skin in the armpits, in the groin, under the breasts and around the genitals. Inverse psoriasis causes smooth patches of red, inflamed skin that worsen with friction and sweating. Fungal infections may trigger this type of psoriasis. Pustular psoriasis. This uncommon form of psoriasis can occur in widespread patches, generalized pustular psoriasis, or in smaller areas on your hands, feet, or fingertips. It generally develops quickly, with pus-filled blisters appearing just hours after your skin becomes red and tender. The blisters may come and go frequently. Generalized pustular psoriasis can also cause fever, chills, severe itching and diarrhea. Erythrodermic psoriasis. The least common type of psoriasis, erythrodermic psoriasis, can cover your entire body with a red, peeling rash that can itch or burn intensely. Psoriatic arthritis. In addition to inflamed, scaly skin, psoriatic arthritis causes swollen, painful joints that are typical of arthritis. Sometimes the joint symptoms are the first or only manifestation of psoriasis, or at times only nail changes are seen. Symptoms range from mild to severe, and psoriatic arthritis can affect any joint. Although the disease usually isn't as crippling as other forms of arthritis, it can cause stiffness and progressive joint damage that in the most serious cases may lead to permanent deformity. Causes of psoriasis. The cause of psoriasis isn't fully understood, but it's thought to be related to an immune system problem with T cells and other white blood cells, called neutrophils, in your body. T cells normally travel through the body to defend against foreign substances, such as viruses or bacteria. But if you have psoriasis, the T cells attack healthy skin cells by mistake, as if to heal a wound or to fight an infection. Overactive T cells also trigger increased production of healthy skin cells, more T cells and other white blood cells, especially neutrophils. These travel into the skin causing redness and sometimes pus in pustular lesions. Dilated blood vessels in psoriasis-affected areas create warmth and redness in the skin lesions. The process becomes an ongoing cycle in which new skin cells move to the outermost layer of skin too quickly in days rather than weeks. Skin cells build up in thick, scaly patches on the skin surface, continuing until treatment stops the cycle. Just what causes T cells to malfunction in people with psoriasis isn't entirely clear. Researchers believe both genetics and environmental factors play a role. Psoriasis triggers. Psoriasis typically starts or worsens because of a trigger that you may be able to identify and avoid. Factors that may trigger psoriasis include infections, such as strep throat or skin infections, injury to the skin, such as a cut or scrape, a bug bite, or a severe sunburn, stress, smoking, heavy alcohol consumption, vitamin D deficiency, certain medications including lithium, which is prescribed for bipolar disorder, high blood pressure medications such as beta blockers, anti-malarial drugs, and iodides. Natural home treatment. How to cure 1. Oatmeal. An oatmeal bath helps hydrate the skin layers and reduce itching and inflammation. It also softens and soothes the skin, as well as calms the nerves. Oatmeal is considered good for other skin problems like dry skin and eczema. 2. Thoroughly mix 1 cup of finely powdered oatmeal in a bathtub filled with warm water. Soak in this oatmeal bath for 15 to 20 minutes daily during flare UPS. When you get out of the bath, rinse with lukewarm water, pat dry your skin and generously apply a good moisturizer. Another option is to wrap 2 handfuls of rolled oats in a muslin cloth, place it in the bathtub and run hot water over it. Next, add some cold water to bring the bath water to a comfortable temperature and squeeze the oat bag. The water will turn milky. Soak in this water for about 10 minutes. You can use the oat bag as a gentle cleanser while soaking. After this bath, pat dry and moisturize your skin. You can do this daily during flare UPS. Make sure to discard the oat bag after every use. 2. Apple cider vinegar. Apple cider vinegar helps restore the natural pH balance of the skin and helps prevent infections. Plus, it reduces itching and skin irritation. Mix 1 teaspoon of organic apple cider vinegar in a glass of water and drink it twice daily, especially during flare UPS. This remedy is also good for overall health as it detoxifies the body. Alternatively, mix together 1 part apple cider vinegar and 3 parts lukewarm water. Soak a washcloth in this solution and use it as a compress for about 1 minute. Repeat several times a day during flare UPS. 3. Ice pack. An ice pack will help soothe the itching and irritation caused by psoriasis. Plus, by numbing the nerve endings, it will also ease acute pain caused by psoriatic arthritis. For chronic pain though, use moist heat like a warm compress. Do not use heat if the joints are swollen. Wrap a few ice cubes in a clean piece of towel or washcloth. Place it on the affected area. Leave it on for 8 to 10 minutes. Do this every few hours throughout the day during flare UPS. 4. Epsom salt. An Epsom salt bath is great for skin disorders like eczema and psoriasis. It will help relieve itching and burning sensations, and soften the scaling that occurs with psoriasis. Plus, it is good for relaxation and detoxification. Mix 2 cups of Epsom salt in a bathtub filled with warm water. Soak in it for 15 to 20 minutes. When you get out of the bath, pat dry your skin and apply a good moisturizer liberally. Do this 2 or 3 times a week. 5. Garlic. Garlic is another useful remedy for psoriasis due to its antioxidant and anti-inflammatory properties. It inhibits the activity of an enzyme called lipoxygenase that causes the inflammation associated with psoriasis. Plus, being an antimicrobial agent, it helps prevent infection. Eating garlic can also prevent psoriasis outbreaks due to its active compounds and blood purifying property. Mix equal amounts of garlic oil and aloe vera gel. Apply it on the affected area. Leave it on for about 15 minutes before washing it off. Do this daily until you see improvement. You can also eat 2 or 3 crushed garlic cloves daily. For best results, let the crushed garlic cloves sit for about 10 minutes before eating them. If you do not like the taste or smell of garlic, you can take it with milk or opt for garlic supplements. Consult your doctor for proper dosage. 6. Olive oil. Olive oil is excellent for dealing with psoriasis because it softens the skin, thereby reducing flaking and scaling. Simply applying lukewarm olive oil generously on the affected area can help treat psoriasis. Reapply several times daily until you get positive results. Alternatively, add 2 drops of calendula oil and 1 drop of oregano oil to 1 cup of olive oil. Apply it on the affected area. Leave it on for a few hours before washing it off. Repeat several times a day during flare UPS. Like olive oil, coconut oil will also help treat the problem.